Welcome back to ARC Seattle on this Friday morning. So glad you're with us. Now in the deep end this morning, a code red alert has been issued across western Washington and Oregon as local blood donations drop to dangerously low levels. Bloodworks Northwest says there's now less than a 1 to 2 day supply of critical blood types and platelets. Tyra's down in the ARC Lounge this morning with Juan Cotto of Bloodworks Northwest. He's here to explain how you can get involved and help out. Tyra?
Yeah, Steve, this is very important. And Juan, thank you so much for joining us on the show today.
Great to be here, and thanks for our media partners for allowing us to share the message.
Absolutely. So this message, code red, what exactly does that mean? You
know, we have a variety of different parameters that go into looking into when we do a code red, but let's make it simple. Right now in the month of January, we're down about 29,000 blood appointments. So we are looking to get that message out to the community. If blood is still constant, it is still a necessary part of the healthcare ecosystem. The late Dr. Beverly Torek story would say blood is still important. It is in a variety of different medical procedures. There's a transfusion that happens in our country every 2 seconds, according to the Red Cross. So we need, and we are hoping that people will step up and want to serve their community by making a blood donation this month.
You said you were down 29,000 appointments. What is the severity of that?
Well, so we need 1,000 donors a day here in Western Washington in our Bloodworks Northwest locations. And then obviously they run through a variety of different tests that go through, and some people come out of those tests not being able to donate. So that's why the number seems to be so large. But it is, in terms of the healthcare ecosystem itself and the service that we provide to medical centers, over 90% in the Pacific Northwest, it's still a very, very important activity, and one where it's a universal activity that does save lives.
What types of blood are most needed now?
Well, O positive is the largest percent of the population. It's about 38% to 40%. O negative is incredibly important because it's the universal blood that can be used in a variety of different situations, but that's only 7% of the population. So the two O's are always important, but right now we have all blood types needed.
All blood types needed, all right. And it's National Blood Donor Month, but aside from that, you know, post-holiday season, winter months, can you just talk about why this season is especially challenging for maintaining that blood supply?
Well, absolutely. We've seen it. It's the holiday season. People are coming back from visiting loved ones and being on their vacations all over the country, and they're coming back. And, you know, in our house this morning, we're getting into the routine of taking our kids to school and juggling a variety of activities. We've done some really unique things at Bloodworks Northwest, working with our Washington State Legislature to promote blood donation. Right now, on the driver's license in the state of Washington, you can add your blood type, and we're really excited about that. You can. Last Saturday morning, I went to the Department of Licensing, and it was so simple to do it. I got in line, and they went ahead and made a change on my driver's license. So we're trying to make sure that we maintain that. State Senator John Lovick, who's a former first responder, a sheriff, it was so cool to hear him say, he said, when I look back at this, I wish I had sponsored that legislation. So to hear the impact that's going to have for first responders, but also, most importantly, for making sure that you know your blood type, and hopefully that'll trigger you to donate blood 3 times a year.
Well, it's nice to see that type of legislation be passed, ones that will have the potential to save lives. For someone who's never donated blood before, what would you want them to know?
It's so simple, and it's so. I have 3 nephews who are big football players, and they're like, Uncle Juan, you know, that needle scares me, and the big old arms, you'd have to hammer the needle into it. It is painless. It is easy. We have streamlined so many of the different processes in terms of our testing and in terms of the finger stick to make sure that your iron is good. We tell people to maybe eat something to make sure they have a little bit of food in their stomach to hydrate before they get there. But it's a really good experience. It's painful. Our phlebotomists are incredible, and you're going to save some lives.
Any other eligibility requirements? I know you mentioned iron testing. Anything else you want to mention?
Yeah. I mean, just you want to be in good health that day. You know, obviously you don't want to be taking aspirin or any other type of, you know, some of the pills that people run for high blood pressure. We definitely monitor that when you get there. But once again, nothing out of the ordinary. If you're feeling good and you're healthy, you have the opportunity to save a life, and you have the time. And we realize that. And it's real easy to get on our website to find times, hopefully close to your location, where you can go ahead and really help us by saving lives in the community.
And where can people sign up for an appointment?
They can go to www.bloodworksnw.org. and they can go ahead and find the process where to sign up. And you can go to a physical location in your neighborhood, hopefully close by. But we have a number of blood drives right all over the community. You can find one close to you.
I know sometimes they'll bring out the blood mobile here to KOMO Plaza,
Yeah.
and a few members of our team, including Steve, have been able to come out.
No, our buddy Steve, and like I said before, we really appreciate our media partners helping us promote this message and amplifying this message throughout the region.
We're happy to amplify it. Thank you so much for coming on the show today, Juan.
Thank you for having us.
Steve, it's certainly a critical thing to do, especially this time of year.
Yep, and I know from personal experience, the phlebotomists with Bloodworks Northwest, some of the best. They make it really
Yes.
easy, painful, or painless, I should say. And please go donate if you can. Appreciate
Good to
that.
know.
Thank you.